So today will be quite hopefully an informal talk on trying to get into cardiology. So feel free if you've got any questions or if you've got any comments to unmute yourself and just raise your hand and let me know, and then happy to answer any questions or anything that comes up. So, and interrupt me at any point. So a little bit of a overview of what we are going to do. So hopefully I won't take up the whole 1.5 hours, at most an hour. I'm going to go through a few different bits and pieces of applying to cardiology. So I think the very first thing I'm going to go through is why cardiology, why choose cardiology as a specialty. And then I'll move on to eligibility or basic eligibility for specialty training in the UK. And then we can talk about the application scoring, what the competition ratio was last year, and then improving scores, and then finally some cardiology specific stuff that you can do to help you look like you are interested in cardiology. And lastly, we'll end with a short Q&A. So feel free to type the questions into the chat or just unmute yourself and ask your questions. So a little bit of a disclaimer. So this is all based on what is currently provided on the ST3 recruitment website. It may change as it has been over the last few years, and things will keep changing and shifting. So I can't be certain that this will be applicable for next year's application, but most of the criteria that has been used to score the different applications are still going to be eligible for the years to come. So no matter what you do to improve your CV, it's going to be applicable. And it's not just cardiology, it's going to be applicable to all the different specialties within medicine, at least from what I know now. Okay, so on to the first section. So why cardiology? So of course, all of you that's in this conference, or at least in this webinar, would have possibly some kind of interest in cardiology. So does anyone want to unmute and tell me why they're interested in choosing cardiology as a specialty, or even just type it in the chat? I'll keep the chat open so I can see any brave souls. All right, so since no one's going to say, oh, someone said it's fascinating. Good. ACS, yes. Love treating ACS. Yeah, yep. Cardiology is one of the commonest presentation to A&E, and even, yeah, exactly. Cardiology presentations, very common. Yep. So having comfort in being able to manage the most common admission to ED is probably one of the biggest comfort in knowing how to treat it properly. Satisfaction is one of those things. Yep. Cardiology probably has one of the highest treatment satisfaction in patients, because you get them well and then you get them feeling better. And there's a good mix of medicine intervention. That is absolutely right. So for me, there's a few reasons why I wanted to do cardiology. Someone said good pay. Not so much in here. Unfortunately, in the UK, the pay is kind of similar unless you go into private practice, but I'm not going to go down that route. So yeah, and it's relevant among the growing elderly population, definitely. And as things get more complex, you're going to need more and more specialists. So yeah, so for me, what I really enjoyed about cardiology, or what drove me into cardiology, was there's a good mix of both acute and chronic presentations. So you've got the acute patients that you can treat when they come into hospital and meet them for the first time. But at the same time, you've got a lot of patients that you will follow them up for a long time. You get to build a good relationship with your patients, like your heart failure patients, which is a great, you get to follow them up and see how your treatment actually improves their quality of life. Again, someone has mentioned this already. There's a good mix of medicine using pharmacological methods and using other non-pharmacological treatment. And also you've got your procedural skills, angiograms, pacemakers. So having a little bit hands-on with a little bit of logical thinking kind of medical specialty. Again, clinical reasoning, it's very useful in cardiology, as with most of the medical specialty. But having cardiology is one of those where you can think your diagnosis out, and then you can think your treatment through, which is why I like it. I'm a very logical thinking person, and it's very research heavy, and there's a lot of new innovations. You get a lot of new stuff coming up every year, so it's always a very, very exciting specialty within medicine. And then lastly, all the treatments that you have in cardiology is very guideline based and evidence based. So it gives you that confidence to say that if I start a treatment for a patient, I'm going to make them feel better because X amount number of patients would feel better on this treatment. And if it doesn't, you've got other options that will keep coming up because of how innovation works within cardiology. So these are the reasons why I wanted to do cardiology, and hopefully these are some of the reasons that will point people towards cardiology as well. So next we'll go on to something straightforward about eligibility for specialty training. So obviously there are several criteria that is required. So you need some basic criteria. You need to meet some basic criteria to be eligible to apply for specialty training. Those trainees that are already in a specialty post like IMTs, or actually it's CMT in the past, but it's IMT nowadays, you will most likely meet most of these essential requirements. For others, so I mean doctors coming from international medical graduates, you need to have a look on the ST3 recruitment website, and that will give you a little bit of a flavor as to what you need, at least the minimum requirement to get into to apply for the specialty training. And it's split into a few different categories, which I would briefly go through, but it should be pretty straightforward. So MRCP, of course, you need your full MRCP to get into specialty, but it's not a 100% necessary requirement, because there are IMT where if you haven't completed your MRCP, you can still apply and get in, and then get your MRCP at the end of, before the end of ST3. Your core competencies, it's basically some basic clinical competencies that is normally obtained as part of the IMT training, which you need to complete before you can pass your IMT training. And also you can otherwise get a what we call an alternative certificate of core competency, which has to be signed off by your local supervisor, which is normally a consultant of that specialty. And then experience, you need to have some experience, X amount of experience within a medical field. And this is all listed within the eligibility on the website. And then UK eligibility is one of the big things in the past. So when I started applying in the past, there was an issue with UK eligibility, because if you are on a visa, you have to wait until national clearing before you can apply, or you can get a job in cardiology. But since October 2019, the medical practitioners has no longer needed to be on the resident market labor testing, which means that everyone gets the same sitting when they are applying for an ST3 post. Lastly, you've got obviously your language and your GMC status as part of the requirements. So you need to be GMC approved. And then you've got your medical qualifications, your health declaration and fitness of practice, which is all listed on the ST3 recruitment website. So if you're thinking of applying, have a look through it just to make sure you've ticked all the boxes before, because these are the minimum requirements you need to apply for cardiology training. So a little bit about application scoring. So this again has changed year after year, and the scoring and the weightage will change again year after year. This is based on what we have currently on the ST3 website, and because next year is the change from ST3 there will no longer be an ST3 in cardiology. You'll start straight into from ST4, because IMT now is 3 years. So this might change again in the new application next year, but I suspect most of the criteria will still remain the same. So, there's a question here. So can we apply directly after MBBS to cardiology? I think it depends on where you graduate from. But if you have all the different criteria, if you fit all the different, at least if you fit all the essential criteria here as stated on the website, you should be able to apply. Next question is, could you get cardiology training from MRCEM or MAS MRCP? I think it must be MRCP because cardiology is a medical specialty, so you need to get the MRC physician to get into the medical specialty training. Okay, so yeah, so as I was saying, this might change is in year to year, but I suspect with this big sections, it will remain similar. So the very first section is additional degrees from undergraduates. So this is specifically for undergraduate degrees that you get during your undergraduate time. So it's basically whether you've got an extra degree whilst you're doing your MBBS or MBCHB, and you can get extra points based on this. So most people I presume most people that are in this webinar will be post this period. So if you don't have it, you won't be able to do anything to change it, because it's all in the past. However, the next section, which is what we call the postgraduate degrees or qualification, this is the part where you can work on if you want to score more points to get into cardiology training. So it can be postgraduate diplomas or postgrad certificates, not MRCP, because MRCP is an essential bit. Other things that you can get are like MD, master's level stuff, or you can go up to higher to MD or PhD. Yeah, so this is the postgraduate degrees and qualification. The next section you can get points is, or the next section that's scored on the application is your additional achievements. So this is mainly prizes and achievements during your medical qualification. So if you have I think it's the top 15% within the medical when you graduate to the medical school, or if you've got some national prizes and stuff like that, you can use this to claim, but you need to make sure you have some sort of proof from your medical school that you have fit this criteria before you mark this on as your score, because all these things needs to be proven in a sense. Okay, and then
Sorry, it's just muted you briefly.
I thought, why was I muted? After this will be, we're looking at presentation. So presentations is mainly the different kind of presentation you can get in conferences. It can be oral presentation where you give a talk, or it can be a poster presentation where you just present a poster. And the score is based upon where you presented. It can be a local meeting within your own hospital. It can be somewhere regional within the region where you're working in. It can be a national or international meeting. Obviously, the highest goal would be to do an oral presentation at a national or international meeting. And all this, I'll give a little bit of tips as we go on later to talk about how we can try and get points in all this, but this is kind of the basic way to get some scores or some points to score on the application. And then after the presentations, you've got publications. So again, it's based on what kind of author you are within that research that's been published, and whether it's PubMed cited. Sometimes if you've written chapters in books, or you've written book related to medicine, you can get points for that. But most people should be trying to aim for some publication. So the top 3 would be what you would like to aim for when you're trying to get a score within the application. Teaching, obviously, teaching is very, very important in medicine, and especially in application, you need to make sure you have feedback. So the feedback can be individual feedback forms that you have, or it can be a collated document to say that this is the feedback that you receive from a teaching that you've provided. Certificates are always very useful. If you have teaching courses, if you've been to teaching courses, always try and ask for certificates, so it can show that you've done X amount of teaching. And then what I would suggest would be also to take up a teaching degree, which is quite easy to do nowadays because most of the universities do distance learning teaching for a kind of medical. When I was applying, that actually gave us a score based on what teaching degree you have. But I think last year, or at least this year's application, has been taken out. Bottom, I haven't seen it. So the next section would be, oh, I've got some questions coming up. Maybe I answer the questions before I move on. So if someone published in Curious Journal, a case report, will that count? So I think if you look back at what the scoring is, so yes, so case reports do count. I think case report is somewhere here. Yeah, so case report counts as 3 points this year. Obviously, the case report, whichever journal that you publish in it has to be a PubMed cited. So the way to find out whether it's PubMed cited or not, you just go on PubMed and see whether the journal is on PubMed. If it's not PubMed cited, then you will go down 1 point to the 2 points one, which are published one or more articles that are not PubMed cited. And then we have, are the scoring systems sort of similar for getting into IMT? Yes, in a sense. So as I said, all these are quite generic stuff that you have for applying into specialty or even medical specialty, medical training. And most of the criteria will persist from IMT across to your specialty training. So yes, so most of this will be applicable even to IMT application, but just check the websites before you like commit yourself to doing different things, because some of these points that you try to get can take a little bit longer than others. No problem, James. Let me admit another person, and the next I've got is, so yeah, so teaching, as I said, try and get some certificate. It's always useful to have proof that you've done X amount of teaching. And then lastly, not lastly actually, second last, we've got quality improvement. Again, quality improvement is always a very, very important part, because this is how we improve our care for our patients, how we improve our service within the hospital. And getting involved in quality improvement is probably part and parcel of training, because within your e-portfolio, at least your portfolio that you have to do when you're in IMT or when you're in foundation year training, there will be some bits that will ask you to be a part of a audit / QIP. So doing a QIP is almost essential to get through it. So you wouldn't want to aim for the lowest point, because that's what everyone will have. What you're going to try and do is get the maximum point. So trying to go through 2 cycles of a QI project. So what I would suggest with QIP is try and do something that is cardiology related if you're really keen to get into cardiology, because it will look stronger on your application that you've done something related to cardiology. And get involved early, because to try and get a couple of cycles, it normally takes a couple of months before you can get down that route, because you need to collect the initial information, perform an intervention, recollect the information to see how your intervention has worked, and then do another intervention before you can recollect the data to see how your intervention has improved. So that will take a few months just by doing that. So start early is my advice to everyone, because normally the application for specialty opens up early in the year, so like January, February time. So try and get those things out of the way early, so that you won't need to have the mad rush to try and get enough points when you're applying. And then lastly, it's the leadership and management. So in this is probably one of the hardest thing to get points on. It's all based upon what kind of leadership post you've held. So if you have been a national or regional kind of leadership role, you get the maximum points, as all these are kind of included on here. And then obviously you can, most people will have a local kind of role which you did within your hospital. So again, this has to be done quite early on, because you need to have at least 6 or more months, and you need to demonstrate you made any impact before you can kind of score yourself for this. So having this to try and get points within this part of the application, you need to try and get in early, speak to the right people, and then get involved so that you've got plenty of time before you go onto the application. And then obviously after all these basic things that you can do before the interview, the next is interview. So when it actually comprises most of the scores for the interview. However, just remember this, you need to have a minimum amount of points in your pre-interview score before you can get through to the interview. So although the interview carries most of the points, having a good pre-interview score is important to at least meet the minimum requirement to get into the interview. The score is different every year. It's all based upon your competition ratio. So I would attempt to kind of get the maximum amount of points as much as they're able to. Obviously, there will be varying, like a normal bell curve. You have people at the top end, you have people at the bottom end. So try and end up on the higher end of the bell curve to give you the highest chance to get into it. And then once you've gone into that, the next step will be the interview. I'm not going to go through the interview because the interview has a few different stations and there's a few different ways of preparing for it. I've got a video on my own channel. So if you search Understand Heart on YouTube, you can go there. And then there's, I've given some top tips on how to prepare for cardiology ST3 interview. So it will be useful. There's always a lot of courses around interview time. BJCA, which is the British Junior Cardiologists Association, is one of the courses. It's one of the organizations that does a lot of courses, and they do a really good ST3 kind of interview course, prep course, where they go through the stations and then they give you feedback on your portfolio. So that was something that I found really useful to go through when I went for my interview. So yeah, so if you're interested, you can have a look on my video, which talks a little bit more about the interview. So next, we're going to talk a little bit about competition. So cardiology has been one of the more competitive medical specialty through the years. And this is similar last year. It's always been around ratio of 4. So normally you have 4 to 1. So every 5 people that apply, only 1 person will get through. So last year we had 131 posts. There's 533 applicants. So that's kind of how cardiology has always been, and it's not changed much. The other specialty has been up and downs depending on what's going on, but cardiology has been pretty consistent. It's always been around 4. From what I can remember since I've last looked in cardiology when I first started applying in 2016. Yeah, so over the last 5 years, it's always been around 4. And then, so it's good to know where you stand, and the way to know where you stand is by looking at previous kind of information. So if you look at the competition ratio in the 2020 ST3 recruitment, this is kind of the range of the shortlisting score. So shortlisting is people that get through into the interview, getting past the interview to the stage of interview. So you can see the mean score is about 44 and 45. Mean and median is about 44 to 45, which is somewhere here. So the scores range from obviously 0 maximum 72. So it's slightly more than 50%. So if you score yourself based on what you have now, you can have a look to see where you stand. What I would suggest to do is to try and get your score as high as you can. I remember when I first applied, my score was, I think it was 30 something. So I was at the lower end, so I didn't even get to the point where I could go on to interview. But over the last few years, I've managed to improve my scores by doing the various things to try and tick off the boxes. And I think my last application score, I was about 58 or 60, I can't remember. But it was enough for me to get into interview and then go on to get into cardiology training. So having this is really, really, really important to understand what competition is and where you stand, because it gives you a guide as to how much you need to push your CV to get to the at least to the minimum requirement of getting into the interviews. So now I'm going to go through the different sections and give like a little bit of a quick tips on what you can do to try and improve your scores. Obviously, if you are one of the ones that are very driven and you already know what you want to do straight out in medical school, if you're still in medical school, consider taking an additional degree, like an MSc, because all this will help you gain scores in the future. An extra year in medical school might give you the extra few points that might be go and no go for you when you get into medical specialty application. Postgraduate wise, so research again is very, very important in cardiology. So even if I think most of the cardiology trainees has recognized that even when they're in training, they understand how important research is, not only to help improve the care to the patients, but also drive the next treatment for cardiology diseases. So most of them do take time out to try and do an MD and PhD. So if this is an area where you are interested in and also where you are lacking points, you might consider doing this. Having an MD or PhD may be very useful to have before you apply, because it will strengthen the number of points that you get and also improve your knowledge, and you're going to present yourself much better when you go to the interview. Obviously, this will require time investment and may not be the appropriate thing for some people, but it's something that is worth considering. I've done a PhD myself, and I must say it was one of the best 3 years of my life to learn. So I learned so much during my years of doing my PhD, and I've managed to help myself get into the point where I can get my current training post. So the next area would be additional achievements. So like prizes, which is very common. There's a lot of national essay prizes available now online. So you just search national essay prizes for medical doctors. You can find lots of them. Two of the commonest ones that I've seen are the Royal Society of Medicine and the British Junior Cardiologists Association. So these are the two organizations that does quite a bit of national essay prizes. So if you get those, you've automatically scored the highest on the additional achievements. And obviously there are some local competitions I've seen as well in different hospitals. Some hospitals organize their own poster competition. Some has their own kind of essay competition. So those are kind of, it's based upon which area you work in, and then you will know and then try and get involved, because those are probably easier places to get points for. And then presentation. So again, locally, most trusts will have some sort of local conference / teaching day. Even within each deaneries, most deaneries, I remember when I worked in West Midlands, they had their own local medical conferences. So where you can present a case, present posters, and all those things will get you points. And what I always find is that I find that you get a little bit lost when you first start out in a new area. So registrars and supervisors are kind of the go-to people to speak to. There's always one or two friendly one where you can talk to, and they will give you advice on what they can do, what you can do to improve your CV, or maybe there are certain things they are working on and they need some help, and you can offer your help to help them, and that might land you a presentation or even a publication, which is the next thing that we're going to talk about. So when I first started writing papers, it was kind of 1 year into my PhD, and I found it really hard to write. And that was even after I've written a few case reports at the start. So I always say start with case reports, because unless you're really good at your academic writing skills, not me, definitely. It took me a little while to get my head around on how to write properly. Case report is a really good way to get yourself kind of inducted into the reading literature and then knowing how to present your case, because you can write a case report in 1,000 words, you can write it in 100 words, but it's harder to write it in 100 words because you need to know what points are salient and how to summarize the little points that is important to bring out your case in the most unique way possible. The same presentation a patient has can come in different ways, and the different ways of presenting the same presentation might land you into a really good case report journal versus a journal that is not on PubMed. So knowing how to write is a very important skill to learn, and I always say start out with case reports is one way to learn how to write. And obviously, the case reports would normally be with the help of registrar supervisor. So try and look for some friendly ones that are quite active in research, or at least quite keen to help you, and that can help you try and get your first publication going. And another way of getting publication would be to help out with the grunt work, as I always call it. So do the data collection, or even do some analysis if your statistical skills are quite good. If not, even just data collection, obviously you need to stay at the front before you start doing it, what your kind of requirements are, what you expect to get out of it. And then certain publications, data collection might not be, you might need to do a little bit more than data collection and do analysis and things like that, but it all depends on what kind of projects you're working on. So always stay upfront as to what you're trying to achieve each time, so that there won't be any misunderstanding with regards to publication in the future. And I think the next thing we'll talk about is teaching. So again, most hospitals nowadays will have a postgraduate department, and you need to, the easiest way to get into teaching would be to inquire from the postgrad department. They've always got medical students coming to hospitals for their attachments, and if you speak to them, I'm sure they would love any help they can get to help with the teaching. And as I said early on, do some distance learning teaching degree is useful to have that. And quality improvement, again, locally is the way to go. Supervisors should be there to help guide you. As I said, this is almost an essential part of medical training anyway, so you should be doing some sort of quality improvement project. And there's always a local lead, so you can talk to them and then get involved. And again, leadership and management is, as I said, is the hardest thing to get score on. Start locally, I always say, find out from your local places, local hospital where you work in, speak to the right people. And then from there on, you can learn how they get to where they are, or even some of them might be able to introduce you to the right people, and you can get some positions within the hospitals. So being the mass president is one of the ways to get in, get points for that, and you lead different kind of little groups within the hospital as well. So another plug for my own channel again. So I've also done a video where I share my experience of my application for cardiology. I've applied 3 times and got lucky on a 3rd time. And each time I've learned different things as I move along. And this is kind of a summary of what I've learned throughout the years, and trying to consolidate all those into a webinar is not the easiest thing because everyone's different. But I think generically there are a lot of things that you can do to try and improve your CV either way. So yeah, if you're interested, have a look. So before I move on, was there any questions? Oh, someone shared my, oh yeah. Oh, thank you for sharing my YouTube channel there. Is it easy for IMG to get into a UK residency? It used to be harder before the 2019 change in putting medical practitioners into the shortage list, because at that time, it's either you go straight from a training program into one of the medical specialties. If not, it will be you need to wait until clearing, which is where there are what we call the leftover jobs, and then you just pick up whatever that is left. But since 2019, because medical practitioners have been put in as a shortage occupation list, you no longer need to wait for that anymore. So you get the same standing as EU and local graduates. So it means that if you have all the right points within your application score, you meet all the eligibility criteria, you should be able to get onto a UK residency program with no problems at all. What was your PhD? So my PhD is on a process called endogenous fibrinolysis. So I was looking into it as a kind of a novel risk predictor for patients coming in with ACS to try and use it to stratify patients. So it's a balance between thrombosis and fibrinolysis. So we're looking on the other spectrum of that. So rather than just focusing on how clots are formed, we're focusing on how clots are dissolved within our body. So that was my PhD. So let's move on. This will be a very quick one. So obviously, if you're thinking of applying into cardiology, you need to have quite specific stuff within cardiology, and that's through showing commitment to specialty. And what I found, or what I've been taught is useful things would be, I think, as mentioned before, joining cardiology societies. So the BCS and BJCA, which is the British Cardiovascular Society and the British Junior Cardiologist Association. So both of those are kind of linked. So I think it used to cost £120 a year. I think it might still be. If you join them, you will have membership into both of them. And not only it looks like you are interested in cardiology, they also hold quite a few talks and webinars, which is quite useful to learn a lot of different things within cardiology. And every year there is the BCS annual conference, which can be quite eye-opening to learn new things. And also it gives you a chance to present there as well if you have any posters or anything to submit to them. The European Society of Cardiology is another one that I'm a part of. So yeah, so those are kind of show that you are engaged within the cardiology kind of societies. Again, attending conferences would be another way to prove or to show that you are interested in cardiology. Again, ESC have their own yearly one, BCS have their own yearly one, and all the different sub-societies within each of the big European society will have their own conferences. So whichever that you're interested in, you can participate in them. It's a little bit easier nowadays because it used to be face-to-face, so you need to physically be there. But I think with COVID, a lot of the conferences are now virtual, so you don't need to apply for annual leave or study leave to go for these. You can just sit at home and then you can join in. And it's always recorded nowadays, so you don't even need to be there live to get your kind of certificate of attendance. Next, I think most people would have the chance at taster weeks. If you're doing foundation program, even IMT, you can apply. I think it's a week for taster week, where you can go have a taster of how each specialty is. So if you've been to a taster week in cardiology, it will look very good on you being enthusiastic to try and get a little bit more understanding about cardiology. And what I try and do if kind of trainee doctors come to taster week with us, we try and get them a little bit of experience in bits and pieces of cardiology. So maybe some cardiology clinics, going to the cath lab, going to the echo department to look at some echoes, or even trying to do some echoes, and then having a ward round on CCU, having a ward round on the cardiology ward, going around with the specialist nurses, and you'll learn that there's so many cardiology is so big, there's so many different subspecialties within it, and even within each subspecialty, you have all the different things that you can do. So 1 week to explore everything cardiology is definitely not enough, but having a week of at least a taster into cardiology might just spark your enthusiasm even more. And why not? It will make you look like you're much more interested in cardiology as well. And in hospitals that you work in, there's bound to be a cardiology department. And with the cardiology department, it depends on whether they do cath lab or echo, but they will have these different things that you will have. So speak to the right people within the department and try and get some experience, or even not even experience in doing it, but even experience in observing an echo session, or even observing an angiogram, observing a pacemaker. It's a lot more than what most people will have, because not many people will have the experience of understanding what goes on within the cath lab. It feels like quite a foreign place, but if you speak to the right people and try and get in early, introduce yourself so you can get some experience in it, and you will sound more knowledgeable of cardiology when you're at an interview. And lastly, as mentioned, try and do some QIP related to cardiology. I've always been told that troponin related QIP is something that every cardiology trainee has to go through. So maybe you can start early and do a troponin related QIP. But there are always other things that you can do with cardiology related stuff: guideline based treatment, looking at discharge, making sure that heart failure patients get discharged and right medications, follow up for heart failure, follow up for ACS. So there's a lot of different areas in cardiology, because all this we have, the thing about cardiology is such evidence-based and so guideline-based. A lot of different things that we do have kind of tick boxes that we need to make sure we do. So having that kind of background to have, doing a quality improvement project is quite easy, because you just need to make sure you meet that criteria and you do different things to try and improve the processes within cardiology. It might just be something simple like having a set pro forma when you're doing a discharge letter, so that all the patients will have X amount of advice when they leave the cardiology ward, and that might be something you can do easily. So yeah, so find out what's going on within your local department, and then you might see different ways that you can improve it. And again, most of the time, if you speak to the consultants, they will have a lot of different things that they want to improve, and you might just be the catalyst that can help drive change within your department. So before I move on, let me just have a look if there's any more questions. So is there any source how to know the competition ratio for different medical specialty? Yes. So the graph, or at least let me see, this table that I shown you is a screenshot from the website. I can't remember the website off the top of my head. I have a look later and I'll post it on the chat. But if you search competition ratio medical training in UK, you will find it. It's quite easy to find. Next is, what conferences can undergraduate students attend? I think you can attend any of the conferences, and normally the conferences always have kind of discount for undergraduate medical students, because we try and engage medical students to try and get involved early. And it's even better if you are presenting something, because normally as a presenter you get free admission into the conferences as part of being a presenter. But you can have a look on as I said, BCS and ESC are the two big ones in cardiology, and those are the two conferences that you can have a look to see whether you will be able to join. But there's no restrictions as to what conferences you can join, because you can join anything. It maybe some of the talks might be a little bit too sub-specialized for medical students, but it can apply to anyone. You might be more advanced, that you can learn all these different things early. What's next? Is attending cardiology related webinar classified under commitment to specialty as well? I think you can. You can use attending cardiology related webinar as commitment to specialty. It's quite a broad kind of category. I did put I went to when I was an FY2, I went to a conference in one of the Royal Colleges about choosing cardiology as a specialty. I put it in as my commitment to specialty as well. It doesn't score any points, because this is kind of like a white box, fill in your blank kind of things. But you can use it to show that you've really thought about cardiology as a specialty quite early on, to show that you're really committed to the specialty. I have experience or training if I have experience of a training by echo from back home, would it give me points to get into cardiology training? It doesn't give you points per se because the application points is fixed. So application points is based upon the different criteria that I spoke about at the start. But it does show that you are committed to the specialty because you've kind of gained an advanced skill, a procedural skill that is required within cardiology. So it will obviously put you in a good place to start with. And then yeah, so it won't give you points, but it will make you look better. When do you recommend start presenting? Oh, as early as you can, I would say, because presentation skill is another thing that most doctors will need to learn anyway to try and obviously when you're teaching and stuff, you need to learn how to present yourself. But having the opportunity to present at conferences, even locally, if you're really good, you can present internationally. Having that experience is immeasurable. I did my first oral presentation when I was in FY2. It was on a renal kind of audit that we did, but that was my first presentation and it was nerve-wracking, but it got me to learn how to present properly and talk when I'm presenting different things. And I got that practice with the consultants that I was working with at that point in time. And I think it really built me up to be able to talk a little bit more smoothly when I'm in front of crowds. Obviously, it's a little bit different now because I'm talking to the computer screen, but you'll realize that it's slightly different when you're presenting to big professors who's sitting right in front of you. And so, yeah, so starting as early as you can is a great thing. So even I've seen, I think at the conference that I presented in, there were medical students presenting as well. So yeah, so you can start at any time. Yes, definitely. Yeah, your first year. Yeah, if you can start right now, do. It's never too early to start. Okay, so summary. So as mentioned, I started always start early because a lot of these different points that you're trying to get takes time to get the points for. So if you know what you're aiming for early on, you can work towards it. And don't lose your drive because what you might find is that it you if you don't get the thing that you're aiming for right away, you might feel a little bit demotivated, but don't. Just keep pushing, you will get it at some point. It might take a few trial and error, a few trials to get to it, but you will get it in at some point. Be friendly with your local seniors and supervisors because that's one easy way to ensure that you get involved in all the right projects and papers and presenting. So yeah, speak to your seniors and supervisors in whichever hospitals that you are in and show enthusiasm. I think most consultants, most registrars will feel happier to engage a junior in their projects if they're enthusiastic and they're keen to try and do the projects, because the things that we're trying to do, like data collection, it takes a long time to do it. And what we're trying to do is to try and get the most out of each data that we're collecting, to try and get presentations, to try and get publication from it. And if you're enthusiastic and you show enthusiasm when you're doing stuff and you get things done on time, you will get a lot of things that you'll get a lot of opportunities to do more and more and more. And that's the way to try and get into cardiology. And not only doing stuff, but also enthusiasm towards a specialty as well. So going to the cath lab, going to the echo sessions and doing cardiology related stuff will show your enthusiasm within cardiology. And lastly, when you're at the interview, you need to show that you're really enthusiastic about cardiology as well. So you need to talk like you really like cardiology, how much you enjoy being a cardiologist, and how much you enjoy to be a cardiologist actually. And then all this will show by the way you talk and by the way you present yourself during the interview. So enthusiasm is something that I cannot stress even more. And lastly, always have a backup plan and persist. Um, as I said, it took me 3 tries to get into cardiology. I got in after 4 years of trying, or 4 different years of doing different things to try and get in, and ended up getting in after my PhD, so which was kind of works out in the end. So you'll get in if you persist with it, but always have a backup plan. Find out every year that you fail, every year that you didn't get into the specialty that you want to, find out why, learn how you can improve for the next try. And once you get that, improve on it, and then you will get better every year. So every year I had a new slight improvement in my scores. And with that, it got me to where I am now. So yeah, so keep persisting. Don't give up. All right, so there's a link for a feedback form. So do fill in the feedback form. We will be very appreciative of it. And yeah, so if anyone have any questions, do type them in the chat. I've been trying to get through them as much as I can. I don't think I missed any. And if you want to unmute yourself, you can unmute and talk to me as well. If not, just type it in the chat. I'll give you about 5 minutes. We'll see how it goes. And in the meantime, let me try and find the website for the competition ratio. Oh, is it not working? So that's the website for the competition ratio. Oops, send it to all. There we go. Oh, I haven't even tried the link myself. It works. Let me copy the link for you. And see whether you can click the link. The one that I just posted on the chat should be. Oh, thank you for the nice feedback. Where can I find undergraduate conferences available? I think it depends on what kind of conferences you're looking for. Free webinar CPD. So webinars, CPD, there's a lot of, so British Junior Cardiovascular Cardiologist Association is one of the areas where you can start looking for things. But I think you need to be a member to get into that. So the BJC, I've copied the link on the post. Oh, I keep pasting in the wrong section. There we go. Yeah. So I keep this is one of the areas where it's quite useful. It's more aimed towards cardiology trainees, but it's somewhere that you can do some learning about cardiology and stuff. There's always free webinars everywhere. I think you can Google it and you can find a lot of different webinars. Like obviously, Medicine Essentials do a lot of webinars like this. And I've done a talk, I think a couple of weeks ago, about cardiology presentation. So it will be on the YouTube link, I suspect, at some point. So yeah. There we go. Links there.